Hi guys, my name is Karen Collum and I'm the Program Director for Ignite Healthcare Institute here in Greenville, South Carolina. You guys are watching this in preparation for beginning your CNA training. We have had to deal with a lot of challenges as we continue to try to train South Carolina certified nursing assistants in the presence of what was initially our first pandemic and now our Delta variant pandemic. We are doing everything we can to continue the training because there is such a need for CNAs, not only in long-term care and in acute care settings right now, but many of you may actually be using this class as a requirement to go further into nursing or beyond. For that reason, we do everything we can not to cancel, reschedule, or change the things that are going on with a class that we're doing. We are going to ask that you be very patient with us in how we navigate. We could even have to tweak the schedule so that there is more remote learning that is currently on your syllabus. But Thursday or Friday of this last week, Heather should have given you a copy of your current syllabus. You'll find that we're a very large group in that there are 30 students in this group. So we have split you into two sections, section A and B, with 15 of you in each section. There will only be several occasions where you will be all together in one room doing lecture. Most of this will be done with Zoom or remote learning on YouTube. We do, however, have to comply with the state regulations to ensure that our skills have been shown, practiced, and demonstrated for you to meet the requirement to take your state exam. Because of the pandemic, almost all long-term care facilities have closed their door to students participating in a clinical setting. Most recently, with the surge of Delta variant, many facilities have gone back on lockdown, even to family members visiting. For that reason, your clinical experience will actually occur in our sim lab. We will have instructors available that will work with you to create an environment much like you would have if you were in a long-term care setting, where we will give you a patient, a scenario, and an option to begin, or an opportunity to begin to care for that individual using the skills that you'll learn in class. This is a 100-hour program. It does meet South Carolina's requirements for South Carolina Commission on Higher Learning, as well as South Carolina DHEC, and you will be testing at our facility approximately 12 days after your last day. I'll make sure and confirm those test dates for you, and it will be divided into 3 dates. We will test 10 of you on each day. When you come to class, I am asking you to please wear a mask. I know this is difficult. I know some of you are vaccinated, some of you are not. It's not a requirement and we're not going to ask. But Delta variant is serious. And whether you believe in the vaccine or not, I want to do everything I can to protect your classmates and even protect myself and the other instructors. I did choose to vaccinate, but despite that, I still mask when I am out in public and double mask when I am in close proximity with others. Part of that's my age because I'm at a higher risk, but I just don't want to bring anything home to my family as well. So I'm really asking you, as tough as it might be for some of you, to please comply with our guidelines. We will have you set up in the classroom so that each of you will be at your own individual table. We will have hand sanitizer available throughout the building. We will give breaks so everybody can step outside and get some fresh air. But we do want to be super diligent about not transmitting the virus or putting anybody in our class at risk. If you find yourself symptomatic in any way, we are asking that you not come to class, contact our office, and let's work with you to get a COVID test or to do some of your remote learning. Then we'll get you back in the class when you are COVID-free to complete your skills. The only thing that might happen in this scenario is you could potentially be asked to test at a later date, only if you miss too much of the class time. The instructors that will be actively involved with you will be myself, as I mentioned, Karen Collum. My background is actually emergency medicine. I started out in the emergency room at Greenville General in 1980 and stayed in the adult emergency room until 1996, then moving on to the pediatric emergency room and am still working in pediatric medicine to this day. I'm in the telephone triage nurse for Parkside Pediatrics and Eastside Pediatrics, taking their calls for sick children after hours, nights, and weekends. With that, it gives me the opportunity during the day to do other things that I love, and one of those things is teaching. I'm very passionate about teaching. I think you'll find that despite not having a traditional classroom, that the class will be enjoyable, non-intimidating, and it will give you an opportunity to learn the materials you need to be successful on our state exam. We purchased the CNA school in 2009, so we have been training students for 11 years, and we, again, are very successful. We have one of the highest pass rates in the state for the state board exam, which we're very proud of. In addition, we have a home care service, which is more like an externship in which students who complete our program and do a very good job could be offered the opportunity to be employed with our office to do home care services. So just kind of keep that in mind as you go through the program, and if that sounds like something that interests you, take time to reach out and speak with me more about that. Another instructor you'll have involved in the program is Heather. Heather, you've probably already met at the front desk. She's our administrative assistant. She is a CNA, and she'll be very active in the lab. My husband will also be involved. His name is Matthew. His background is also emergency medicine, but the pre-hospital setting as a paramedic. And then we will have a couple other additional individuals that will come and help us with our skills. On those days that we are doing skills, despite the fact that there will be 15 people in class, we will break you up in groups of 5 before we go in the lab. Again, we are doing everything possible to protect you and keep you healthy and safe during this global pandemic while we are trying to train and move forward to provide healthcare services to those in need. The class times have been set on your syllabus. If there are problems, again, I need you to communicate that with Heather or I as soon as possible so we can work with you on the schedule. I also, on Monday, will go over the syllabus in more detail with you because sometimes it can be confusing, and I just want to make sure that you guys understand what the expectation is each day for the next 3 weeks. The class is fast-paced, and it is done in 3 weeks. So again, hang on for the ride. You guys will do great, and we will do everything we can to make you successful. The office number, most of you already have that, area code 864-458-3590, if you should need to reach our office or machine. My contact information is area code 864-419-3757. Matthew's contact number is area code 864-444-4434. I told him he better never give that number up. We can be reached anytime. Although we don't like getting text messages at 2 in the morning, our phones are on 24/7. So please feel free to reach out to us with questions about class or other considerations that you need to discuss with us. Again, we are really looking forward to this opportunity to teach you guys and get you prepared for what you have coming, moving forward. Again, some of you are already working in this profession, some of you are taking on a new career, and I do know that some of you are moving forward. I assure you that the tools you need to pass the state board will be presented to you. We will make sure that we meet the requirements for the state of South Carolina for all of our hours, skills, and hands-on opportunities. We will also give you opportunities to have a practice or dress rehearsal in the days between the last day of class and the state exam, which is called mock exam, which will give you a chance to come in and role play through the process. So again, we look forward to having each and every one of you. I will plan to see you guys tomorrow. Group A will be there in the morning. Group B will be there at lunchtime. We will talk more about the materials that you've received. We will plan to go through 2 chapters, chapters 1 and 3. Please try to read those chapters before you come tomorrow, as well as look through the short segment on patient confidentiality, as we will take a brief quiz on your very first day of class. Again, please feel free to reach out to me. Sorry this video was a little later than we thought getting loaded. We loaded the skills video welcome, not my welcome. So again, welcome to CNA. We'll look forward to seeing you tomorrow, either morning or midday. Again, you may even reach out to me today if you have questions or concerns before class starts. Again, Karen Collum, 864-419-3757. Thanks, and have a good evening.